Hi everyone. Today I'm here to tell you that vaccines save lives. It is the fear of these vaccines that endangers them. Advances in science have allowed us the privilege to be better protected from diseases and viruses that were once known to be fatal. For example, smallpox was an extremely contagious, painful disease that killed 3 out of 10 people. Thanks to the smallpox vaccine, the last known case was in 1978, and since then the disease has been completely eradicated. The issue under debate today is whether the human papilloma virus vaccine should be made available to all adolescents. It's my professional obligation as a registered nurse to advocate for evidence based medicine and to tell you that this vaccine absolutely should be made available to all adolescents. The human papilloma virus is the most common sexually transmitted infection in the world, infecting 550,000 Canadians annually. Anyone who is sexually active is at risk for contracting the virus, even though they may not develop symptoms or realize that they have the virus. This is significant because barrier methods such as condoms are not effective in reducing the transmission, and although someone is asymptomatic, transmission can still occur, which further exacerbates the prevalence of the virus in society. Out of the more of 200 strains of HPV, the vaccine protects against 9 of these strains that are known to be group 1 carcinogens, causing cervical, anogenital, and oropharyngeal cancers and lesions. If administered prior to sexual exposure, it is almost 100% effective in protecting against cancer development and significantly reduces the transmission of these strains. As with all new medications, there are concerns about the safety and efficacy of this vaccine. Prior to FDA approval, the Gardasil vaccine and Gardasil 9 vaccine was studied in over 29,000 males and females and over 15,000 males and females, respectively. The clinical trials showed that 97.4% of side effects were mild, such as pain in the injection site, fever, and headache. Since the vaccine has been brought to market, there have been over 120 million doses administered in the United States alone, and over 160 published studies have been proven that the HPV vaccine is in fact safe to use in both men and women of all ages and races. Pap smear screening exams have proven to be effective, reducing the development of cervical cancer in women. However, on average, 20 to 40% of women worldwide do not adhere to routine screening recommendations. Furthermore, there are currently no approved screening initiatives for men and women for anal, penile, and oropharyngeal cancer. Therefore, without the vaccine, this population of men and women are extremely vulnerable to experiencing cancer diagnoses. The question that I will leave you with is this: should we allow personal fears of a vaccine that has been scientifically proven and deemed safe many times over to put the human race at an increased risk of cancer when there is a vaccination that could eventually eradicate this extremely prevalent and serious sexually transmitted infection? Let's stop the virus in its tracks and allow all adolescents the opportunity to be vaccinated with the HPV vaccine. Thank you.